All right, good evening, everyone. Thank you for joining us tonight for the Medicare 101. Tonight we're talking about Medicare Part D. Looks like we still have some people jumping in, so I'm going to give it like one more minute to see if we can get some more people in before I get started. Hopefully everybody was able to get the email that I sent this morning that included the handouts that accompany this presentation, as well as the slides for this presentation. We're going to talk about Medicare prescription coverage. We will have plenty of time, hopefully, for questions and answers, and I will pause during the presentation to see if there are any questions. If you have questions, you can either type them in the chat box and I'll address them as we go, or you are welcome to unmute when I pause for questions and ask your questions over the audio. All right, well, let's go ahead and get started. I don't want to get this started too late, so let's see. So again, welcome. My name is Roma. I am with the Area Agency on Aging and the Pikes Peak Area Council of Governments. Oops. And I am a SHIP counselor. And tonight we are talking about Medicare Part D. This is the third part in a 4-part series. And we're going to start with who we are. So again, I'm with the Area Agency on Aging, and the mission of the Area Agency on Aging is to provide services, find and develop programs and systems to help people in El Paso, Park, and Teller counties be able to reside in their homes and in their community for as long as possible. So we are a lead advocacy agency for the senior community or the older adult community in El Paso and Park and Teller counties. I am also with the SHIP program, or the State Health Insurance Assistance Program, which is a federally funded program that's designed to provide unbiased and in-person one-on-one counseling on all things Medicare. So we can help anybody and everybody with any questions regarding Medicare benefits, coverage options. We can help you with Advantage plans, drug plans, retirement plans, employer plans, TRICARE, para, you name it. We have 5 counselors who are available to anybody at any time. And that's what we do. Our contact information is provided here. A quick review of what we've covered in the first couple of weeks already. The first week we talked about enrollment and eligibility and Medicare's Part A and B. Again, Medicare Part A is free for most people, covers your inpatient hospitalizations and services, and some deductibles and co-insurances apply. For Part B, everybody has to pay a premium for Part B, covers all of your outpatient services, and there are deductibles and co-insurances for Part B services. Medicare's Part A and Part B together are called or considered original Medicare benefits. And then last week we talked about Medicare supplements, or also known as Medigap, and Medicare Advantage plans in a little more detail. Those are your 2 options that are available to go with original Medicare or to work with original Medicare. Both options are regulated by Medicare, and there may be limited opportunities to enroll in those kinds of options. Oops. And then tonight we are talking about Medicare Part D. D for prescription drugs, D for drugs. It is the newest benefit of Medicare for outpatient pharmacy assistance. So it is the drug benefit of Medicare. It provides coverage for outpatient prescription medications only. So if you have to take a prescription to the pharmacy, that is going to be a Part D benefit. Medicare Part D, again, is one of the newest benefits of Medicare. It went into effect in 2006. Prior to that, Medicare did not have prescription coverage at all. For prescription, Medicare prescription plans, we are going to talk about formularies, which are the list of drugs that each plan may cover. We're going to talk about costs. We're going to talk about deductibles and copays. And we're going to talk about any assistance that might be available for people who are low income. But we're going to start with, should you enroll in Part D? As with all benefits of Medicare, Medicare Part D is optional. You can choose to join a plan or not. In order to be eligible to enroll in Medicare Part D, you would have to be enrolled in Medicare Part A or Part B or both. For other benefits or other coverages that are designed to go with Medicare, you typically have to be enrolled in both A and B. But for the prescription Part D drug coverage, you only have to be enrolled in A or B or A and B. The other question, the first question you probably want to ask yourself is, do you already have drug coverage? And is that coverage considered creditable? Meaning, is it as good as Medicare Part D benefits? Examples of credible coverage, drug coverage, would be perhaps drug coverage you have through an employer health plan. If you use the VA pharmacy, any kind of other prescription drug benefit that you may have access to, as long as it's considered as good as or better than what Medicare offers as a Part D benefit, then you can actually delay or not enroll in a Part D through Medicare. If you do have other drug coverage that's considered credible, and that is why you don't enroll in a Medicare Part D, there are no penalties associated if you do enroll in a Part D down the road. So if, for example, you currently have prescription drug coverage through employment or through a retirement benefit, and it's considered credible, it's as good as or better than what Part D offers, if for some reason you lose that coverage in the future, when that coverage ends and you enroll in a Medicare Part D, there will be no penalties for not enrolling sooner. And if you have the option of going with either or, keeping your current, perhaps your current drug coverage or enrolling in a Medicare Part D, things that you'd want to consider are costs and try and determine which benefit would be more cost effective or just a better benefit, a better fit for you. If you choose not to enroll in a Medicare Part D and you don't have other drug coverage that would be considered as good as or better than Medicare Part D, Medicare would allow you to enroll in coverage anytime down the road, but you would probably be assessed a penalty for not having enrolled when you were first eligible. So the only way to avoid penalties with Medicare is if you have what they consider credible coverage in place of enrolling in Medicare. And as long as you have credible coverage instead of enrolling in a Medicare benefit, if you enroll later, there's usually no penalties associated with that. So for Medicare Part D, there are limited opportunities to enroll in the Part D benefits. Those opportunities are called enrollment periods. There are basically three primary enrollment periods. The initial enrollment period, which is the enrollment period that surrounds your eligibility and enrollment into Medicare for the first time, usually surrounding your 65th birthday. That initial enrollment period is the same enrollment period as the initial enrollment period into Medicare. It's the 3 months prior to the month of that 65th birthday or month of eligibility, the month of and up to 3 months after your 65th birthday month or month of eligibility. Then you would also have an opportunity to enroll during the annual election period, which we typically just refer to as open enrollment. That is the fall enrollment period, which happens October 15th through December 7th each year. any enrollments you do during that time frame go into effect January 1st. And then special enrollment periods. And special enrollment periods are situations where, again, for example, you had employer drug coverage, or you had drug coverage through an employer health plan, and that was your reason for not enrolling in Medicare Part D. And when that employer plan ended and you had to enroll in a Part D at that point, because you were losing employer coverage, that created a special enrollment into Medicare Part D. And we're going to, we'll refer to those enrollment periods as we go along as well. So if you choose not to enroll in a Medicare Part D and you don't have other critical drug coverage, so for example, you simply don't take any medications. And I have plenty of people who ask me, well, why should I enroll in this benefit and have to pay for this benefit when I don't take any medications? Perfectly legitimate question. But the answer is so that you avoid penalties. Penalties are designed specifically to discourage people from waiting to enroll in coverage with Medicare. It's designed to discourage you from waiting to enroll until you need it. So if you waited to enroll in a Medicare Part D drug plan until you suddenly had a $1,500 a month drug that you need covered, and if everybody did that, then the cost of our coverage would be a lot more than it is these days. So it's simply to discourage people from enrolling, waiting to enroll until you need to enroll because you have some sort of medical issue that is causing you to need that coverage now. If you do delay enrollment and you are assessed a penalty, the penalty is calculated at 1% per month for every full month that you could have enrolled in a Part D but didn't. That 1% is going to accumulate for however many months it's been since you were initially eligible to enroll. And then when you do enroll, they're going to calculate the number of months that you could have enrolled. They're going to multiply that amount times that year's national average base premium, which for 2021 is $33.06. So they're going to multiply the number of months that you delayed enrollment by that national average base premium. Whatever that comes out to is going to be tacked on top of the Part D premium that you do ultimately end up paying when you do enroll. The downside of Medicare penalties is they last forever and ever and ever and ever. So that penalty will always be tacked on to your Part D benefit for as long as you enroll in a Part D benefit. Now, if you are in a situation where you have lower or limited income and you may qualify for what's called extra help or low income subsidy with Part D coverage, penalties are not assessed, they go away. But if you do get a penalty, that penalty is forever. And because that penalty is based on the calculation of multiplying it by the national average base premium every year, your penalty amount will be the same. So for example, if you waited 15 months to enroll and you have a 15% penalty, your penalty will always be 15%. But every year when the national average benchmark premium changes, so will the amount of your penalty. So every year they'll recalculate that penalty based on that national benchmark premium. So not only is it going to be tacked on to your costs every year, every month, forever, it's going to change on an annual basis. The other thing you need to know about Medicare Part D costs is that they are also, as Part B is, they are also means tested. So what that means is the higher income you may have, the higher premium you may have to pay for Part B or Part D. Part B as well, but Part D. The chart here shows you the income ranges. So what they look at is your annual income, annual adjusted gross income, and it's listed here for both an individual and a married couple. Income threshold before you'd have to start worrying about paying a higher Part D premium based on income for an individual is $88,000 this year, $176,000 for a married couple. What Social Security bases that on again is the most recent complete income tax filing that they can access, which in most cases is going to be a year or 2 years old. In many situations, if you receive notice that you are going to be assessed the IRMAA or income related monthly adjustment amount to your Part D premiums, but your income is no longer at the level that they used to determine whether or not you had to pay a higher Part D premium, you can appeal that based on the fact that your income is no longer that high. So if you were working in the tax year that they access to determine that you would have to pay a higher premium, but in the meantime, you've retired and your income is no longer at that level, you are not going to be required to pay a higher premium if your income is currently not at the level when you receive that notice, and you can appeal that. So don't feel like you're stuck having to pay that. Any questions about any of this so far? Again, you can either type into the chat box or you are welcome to unmute and simply ask your question. All right. Well, I'm
sorry, I actually do have a question. With Part D, you said that with the penalty, it changes annually. So does that mean like 1 year they could pay like an amount, like the next year, would that go down or would it always increase annually?
Again, it's going to be based on the national average benchmark premium, which can fluctuate from year to year. And it can potentially go down. So the national average benchmark premium last year was $34 and change. So it actually did decrease for 2021 by $1. So it's not ever going to be a huge amount, but it will fluctuate, and it will fluctuate based on whatever that national premium is. So if premiums start to increase significantly at some point in the future, then that penalty will reflect that as well. Any other questions? My best advice, honestly, is just don't incur a penalty. I mean, it's really the best thing to do. And, you know, for those people that have the concern that why would I have to pay for something that I am not using because I don't take any medications, you know, my best answer is that Medicare wants you to look at coverage through the Medicare system, the same way you look at coverage that you get in any other way. So employer coverage, private health coverage, home insurance, auto insurance. We don't buy insurance because we intend to use it or because we need to use it. We buy insurance in case something happens. And Medicare wants you to look at those benefits in the same way, so that you're investing in something that you potentially may need to use, whether you're using it now or not.
I had a question about appealing the income level. Is there are you going to review that, or is there you can direct us to that information?
So if you receive notice that you may have to pay a higher Part D premium based on income, that notice from Social Security will typically include instructions on how to appeal that. If for some reason it does not, then you're welcome to email me after this presentation or tomorrow or sometime next week, whenever, and I will direct you to the form that you would download from Social Security to appeal that.
Okay, thank you.
Yeah, but usually the Social Security, as convoluted as Social Security notices can be, and I know there are many pages that don't seem to have any useful information, there's always going to be instructions on that, what you can do if you disagree with what they're suggesting. All right, so let's talk about coverage. How does Medicare Part D work? So Medicare Part D, again, was created in 2006. It was developed and created by Medicare, and Medicare's basic outline for any and all Part D plans is as follows. So Medicare says that drug coverage, the drug benefit will have an annual deductible. For 2021, that annual deductible is $445. So if you have a Part D plan that includes a Part D deductible, what that means is when you go to the pharmacy after you enroll in that plan for the first time, you will have to pay full retail price for your medications until you spend $445 before your drug plan actually kicks in and starts paying part of that cost. Once the deductible is met, then Medicare's drug benefit will start covering approximately 75% of the cost, the retail cost of your medications, and you will pay approximately 25% of that cost in the form of a copay. And you will continue to pay 25% of that cost as in the form of a copay until you hit the initial coverage level. And this year, that total amount before you hit the initial coverage level is $4,130. So the way they calculate that is they take the amount that you pay at the pharmacy, they take the balance that the plan pays and add them together. And when the total cost of the drugs that you have purchased over the course of the year, if they add up to $4,130, then you will hit what they call the coverage gap, or the donut hole, as more commonly referred to. If somehow your drug cost gets you to the coverage gap or the donut hole, once you reach that coverage gap, you will continue to pay 25% of retail cost in the form of a copay at the pharmacy. And as of 2020, that is for both brand name and generic drugs. Prior to 2020, if you hit the donut hole or the coverage gap in your benefits, you could have gone back to paying potentially 100% of the retail cost of your medication. When Part D was first created, that's how it worked. You hit the donut hole, you went back to paying full retail cost, and you still had to pay the premium for that Part D plan that was not going to pay anything while you were in the donut hole. As time went on and government regulations were adjusted, the amount that you paid when you hit the coverage gap was gradually reduced year by year. And the goal was that the donut hole would be closed by 2020. Many people assumed that that meant that when you hit the donut hole, you would pay nothing. Unfortunately, that is not accurate. What that meant was by 2020, the most anybody would pay at the pharmacy for their medications when they hit the coverage gap would be 25% of retail. And in a minute, I'll explain how that might be different than the 25% potentially you pay before you hit the donut hole. In the donut hole, again, you're paying 25% for both brand name and generic drugs until your total drug costs reach another $5,183 and change. If within the course of a calendar year, your drug costs total $10,048 and change, then you would enter into what they call the catastrophic coverage level, and your costs at the pharmacy would go down to 5% of retail or less, or at most $3.70 generic copay, $9.20 generic or brand name copay. In the catastrophic coverage, you pay 5% or less. The plan only pays 15%, and Medicare pays the rest of the cost of your medications until the end of the calendar year. And then come January 1st, that cycle starts all over. So the difference between what you pay at the pharmacy during the initial coverage zone, which is potentially 25% of retail and your end, and the difference between what you pay as 25% in the coverage gap can be two very different amounts. So Medicare's basic outline of coverage, which is what this is the bare minimum outline of benefit that any Part D plan can offer you in any way, says that during the initial coverage level, you could pay up to 25% of retail. However, most plans do better than that. Most plans do better than making you pay 25%. So most Medicare Part D plans will offer benefits that provide zero copay generics or, $10 copay brand names during the initial coverage level. So you may be paying significantly less than 25% at the pharmacy for your medications during that initial coverage level, depending on what plan you enroll in. But when you get to the coverage gap, if you hit that coverage gap or that donut hole, then your cost would go from that zero copay generic to actually 25% of the retail cost of that generic. So you may actually see an increase in the cost of your medications. On the other hand, it may also go the other direction. If you have a plan that you're paying a $40 copay for your brand name medications during the initial coverage level, and then you hit the donut hole and 25% of that cost of the brand name drug is only $25, then your cost may actually go down from a $40 flat copay to $25 copay based on 25% of the cost of that drug. As time has gone on, how drug costs are determined by these drug plans has gotten kind of convoluted, and it can be a little confusing. But, overall, it can be a very good benefit and save a lot of people a lot of money. So let's talk about what these drug plans are required to cover. So Medicare Part D plans in any way, shape, or form, whether it's through a standalone prescription benefit or whether or not the drug benefit is part of a Medicare Advantage plan. All Part D plans are required to cover at least 2 medications in every medical class of medication available. That could be a good thing and that could be a bad thing. For example, if there are 20 different medications for high cholesterol, the Part D plan only has to cover 2 of them. Many plans will cover more than that. Some plans will not. So plans can vary quite significantly on what they will cover and what drugs specifically they will cover. There are 6 classes of medications that every plan must cover any drug that's available on the market under those 6 classes. And that includes all antidepressants and antipsychotics, all anticonvulsants and antiretrovirals, immunosuppressants, and antineoplastics. Any Part D plan has to cover any drug available under those 6 classes. Also required that Part D will only cover prescriptions that are approved by the FDA and approved for their medically intended purpose. And what that means is that if the doctor is prescribing Viagra to you for high blood pressure, that is not what Viagra was initially intended to be used for. And so Medicare would not cover that because it's not being prescribed for its medically intended purpose. Part Ds have to cover all drugs, biologicals, and insulin, including the supplies for injecting insulin. And all plans must cover brand name and generic drugs on their formulary. Things that would not be covered under Medicare Part D are going to include drugs that would already be covered under other benefits of Medicare, such as A and B. So any medications you get while you are inpatient in the hospital would be covered under Part A. Medications covered under Part B are going to include like infusions that you get in a medical setting, chemo treatments, dialysis treatments, injections that you have to have administered by a medical professional in a doctor's office. All of those would be covered under Part B of Medicare. Again, anything covered by Part D is something that the doctor gets you a prescription. You have to take that prescription to the pharmacy. Medicare Part D does not typically cover over-the-counter medications. In other words, they do not require a prescription. And even if they require a prescription, Medicare will not cover any drugs that are designed specifically to treat anorexia or for fertility purposes or for cosmetic purposes only. Again, even if it requires a prescription from the doctor, Medicare will not cover any prescription that's specifically and solely for cough and cold symptoms. Guaifenesin or Robitussin is a perfect example of that. And it does not cover most vitamin and mineral supplements. There are some exceptions, prenatal supplements, fluoride, some vitamins to treat specific diseases could be covered. But as a general rule of thumb, most vitamin and mineral supplements would not be covered by Part D. There is some financial assistance available for people who have limited or low incomes to assist with the costs of Medicare Part D. I've listed the income and asset guidelines for 2021. The income dollar amounts are in pre-deduction or gross dollars. We do help people with these applications, and we're certainly happy to talk to anybody who has any questions or would be interested in getting more information about applying for assistance. Just give us a call or shoot me an email, and we're happy to help you with that. If you do qualify for assistance with Part D based on these income and asset limits, what that provides is reduced or eliminated premiums for drug coverage. It provides reduced or eliminated deductibles, and it certainly provides reduced copays at the pharmacy, and it eliminates the donut hole where costs may go up. If for some reason you don't qualify for financial assistance through that program, but you still take some pretty expensive medications, and 25% of the retail cost of a medication, if you hit that coverage gap, would be unaffordable, there are still programs available through the drug manufacturers that might be able to provide financial assistance on some of those more expensive medications. I've listed some websites here that provide some additional information on what medications might be available through patient assistance directly from the manufacturer. Typically, if you take a very expensive medication, there usually is going to be a patient's assistance available for help with that cost. People with Medicare drug benefits are not necessarily excluded from patient assistance. And to qualify for patient assistance through the manufacturer, the income and asset limits tend to be much more generous. So if you are taking a brand name, newer medication that's very expensive, we can also help you with finding some information on getting some assistance with that. Again, the low income subsidy or extra help is applied through Social Security. There are different levels of assistance that you can get based on income and assets. And to apply, you could either go to the Social Security website, you could call 1-800 Social Security, and quite honestly, they'll probably tell you to call your local SHIP office, which is us, and we're happy to help with those applications. So that's the basics of Medicare drug coverage and how it works and what's covered. The specifics on how to find a drug plan that's going to work best for you can get a little more complicated. There are approximately 27 standalone Part D drug plans available to choose from in Colorado for 2021. And then there are probably the same number of drug plans available as part of a Medicare Advantage plan in our area. And each and every one of those plans is going to have a different formulary or list of drugs that they cover. They're going to have different copays. They're going to have different deductibles. They're going to have different premiums. The costs are going to vary from one plan to another quite significantly. And it's going to be very important for you to make sure that whatever plan you do enroll in actually covers your medications. And because the formulary from plan to plan can vary significantly, that is going to be the first thing that you need to determine is what plans, first of all, cover the drugs that you take. And then once you find the plans that cover those drugs, you want to make sure you find the plan that's going to cover those drugs for the best price or the least amount of cost. How are you going to do that? Well, options are pretty basic, pretty limited. You can either call a plan directly and ask them to go drug by drug to make sure that all of your medications are on their formulary and at what copays. You can call an agent or a broker and ask them to do that for you. Or you can go online to Medicare.gov and use the Medicare Plan Finder and do it for yourself. We also, at our office as SHIP counselors, are happy to help you do that as well. We're trained directly by Medicare to help people with that process. In order to use the Medicare.gov Plan Finder, which is basically a search engine, Medicare again does encourage you to create a My Medicare account. So if you haven't done so already, Medicare encourages you to do that. One of the handouts that I sent earlier today included an instruction sheet on how to create a My Medicare account. It's quick, it's easy, literally only takes a few minutes to set up. The benefits of having a My Medicare account: it saves your searches, it saves your drug list. You can print a duplicate Medicare card. It also has an electronic health record that you can allow your doctor to access. So you can keep all your medical records in it. It's very secure. It keeps a history of all the plans that you may enroll in over the years. Because when it comes to Medicare Part D coverage, it's not very likely that you're going to keep the same drug plan year after year after year. That's the whole point of the annual open enrollment, is so that you can view and review all of the options from year to year to make sure that you are getting the plan that's going to be your best, most cost-effective option every year. And there is no penalty for switching plans. There's no worry about, is a plan going to take you? The whole point of open enrollment is that you are allowed to find the best plan for you every year without question. And having that Medicare account can help in that process. This is a screenshot of the Medicare.gov homepage. And what I've circled here is the button that you push, Find Health and Drug Plans. That's going to take you to that Medicare Plan Finder, or that search engine that's going to help you determine what drug plans are going to be your best choice, your most cost-effective choice. You do have also the option of doing a search through this Plan Finder without creating an account. And I've circled here in little tiny print because they really would rather you create an account that says continue without logging in or creating an account. It gives you the same search options. It takes you to the same search engine. So there's no disadvantage to doing that. And the advantage of using the Medicare Plan Finder, honestly, is that it is a search engine. And what it's designed to do is it's designed to let you input all of the medications that you take down to quantities and dosages, your preferred method of getting medications, whether it's mail order or going to the pharmacy. You can choose up to 5 preferred pharmacies that you would want to access, or you might access, so that the end result is it has compared all of your medications to what plans cover them. It has compared the pharmacy preferences to what plans participate with those pharmacies. And the end result is it lists all the drug plans available in Colorado in order of the plan at the top of the list is going to be the plan that gives you the best coverage for your needs at the least amount of cost. And the plan at the bottom of the list is going to be the plan that gives you the worst coverage at the highest cost for your medication needs. So it really does all the work of searching out the plans that cover your medications and then determines which of those plans provide the best savings. It is an amazing tool to have access to. It would literally be a full week's task to have to try and call all the plans and check to see if they cover your drugs, find out what the copays would be, what the premium would be, do all the math to determine which one of those plans would save you the most money. It'd be impossible. So the search engine does all that work for you. So it is a wonderful tool to access and to use. And I strongly encourage you to take advantage of it every year during open enrollment to make sure that again, you're getting the best deal and saving the most money every year for your drug coverage. Now, open enrollment, the annual enrollment period, gives you that ability to make changes to your drug coverage every year without restriction. And many, many times, people who take advantage of that annual open enrollment period do end up changing to a different drug plan from year to year. It has become a quick and easy and simple process. And it can be done through the Medicare website, through this plan finder. And it's really not as complicated or as messy as it sounds, because they make the transition very smooth. So it really is to your advantage to make sure that you check every year to make sure that you're getting the best deal. I can't tell you how many people I have come across who enrolled in a drug plan when they first became eligible for Medicare and thought that that was the only thing they had to do is get a drug plan. And they just kind of assumed that that drug plan was always going to be their best choice. And 4, 5, 6, 7 years later, they come back to our office and we realize that they're paying over $100 a month for drug coverage, and it's only covering half of their drugs. And they're wondering why their coverage is costing them so much. And that's because drug plans change every year. Not only do you have an opportunity to make a change during open enrollment, but it's also the opportunity that the plans have to make changes to their coverage. And changes that could be made to the coverage itself could include premium changes, could include formulary changes, copay changes, pharmacy network changes. So even if you do end up keeping the same plan year after year, it's to your advantage to check that plan every year to make sure that it still provides you with the coverage that you need, that it still participates at the pharmacy that you use, that the premium is still going to be, within the bounds of reason. There was one plan last year that went from a $25 premium to a $100 premium overnight. And many people thought that that was the best deal. They kept it and did not realize that come January, they were going to pay a $100 monthly premium to have that plan. So I really can't stress enough or encourage you enough to take advantage of open enrollment every year to make sure that you're getting the best deal. And with that, I will pause to see if there are any questions. Again, you can type in the chat box or just unmute yourself, and I'm happy to hear your question.
You have several questions in your chat, Roma.
Okay.
If you can see that, if you can see the chat, or I can read those for you.
Nope, I got them now.
Okay.
Okay. So the first question I'll address is, are you required to use your Part D when you enroll, I'm assuming, or may you use like GoodRx if it's cheaper? And the answer is yes. You are allowed to use other options besides just your Part D. And that is a rule that has changed just recently. As recently as 2 or 3 years ago, if you went to the pharmacy and the pharmacist knew that you had a Part D drug plan, that pharmacist was only allowed to process your medications through that plan. As of today, if you go to the pharmacy and your copay with your Part D plan is going to be $20, but you look at GoodRx and it's only going to be $8 through GoodRx, you can use GoodRx. The drug is not going to be processed through your Part D plan, and so the cost is not going to go towards your donut hole or your deductible or anything like that. It won't even be processed through Part D, but you are allowed to use whatever option is going to be most cost effective to you. So the next question is, please define the initial coverage again. Is that the first year or does it reset each year? So that initial outline of coverage, that basic outline of how Part D plans work, is an annual cycle. So the $445 deductible, you pay after your initial enrollment. Then you pay the 25% during the initial coverage level. If you hit the coverage gap, you go to 25% if you hit the catastrophic. Regardless of what level you hit, come January 1st of the next year, it all resets. And you have to pay another deductible if you have one. And the whole cycle starts over. So everything is on an annual cycle, and it does reset in January every year. Another question, is acne considered cosmetic? Well, that's a good question. Honestly, I don't know the answer to that. I guess it would depend on the specifics of the diagnosis. And it would certainly be something that I would encourage you to talk to the doctor about, as to whether or not it would be considered cosmetic versus medically necessary. I can see how it could be both. Next question, who pays agent brokers? Any idea how much they charge? Okay, so if you use an insurance agent, which is an agent who is dedicated to a specific insurance company, and they sell only insurance for that company, or if you use an insurance broker who is not dedicated to one company but can offer plans from multiple companies, who pays them? The insurance companies. Your cost does not change to buy any sort of Medicare related benefits through an agent or broker versus calling the company directly yourself. So there is no extra charge to use agents or brokers, and they cannot charge you to help you enroll in a Medicare related product, period. And if you're finding anybody who is attempting to charge you to enroll in any Medicare related product, please let us know. I would love to find that out. But there is no difference in what you pay, whether you use a broker or agent or not, and they cannot charge you. Next question. So to verify, you can create an account, My Medicare account, without being signed up for Medicare yet. The answer is no. In order to create a My Medicare account, you do have to have a Medicare ID number. So once you know what your Medicare ID number is, then you can create that account. Next question, is the process the same with Medicare Advantage, or is drug coverage part of Advantage, Medicare Advantage? So if I understand the question correctly, is there a difference between Medicare Part D and the drug coverage offered through a Medicare Advantage plan? And the answer is no. Medicare Advantage plans that include drug coverage, that is your Part D benefit. So whether you get Part D in a standalone, by itself, just drug plan, or whether or not you have drug coverage as part of your Medicare Advantage plan, it's still your Part D. It still works the same way, still follows the same outline of coverage. And the coverage can still vary from Advantage plan to Advantage plan significantly. It can even vary from Advantage plan to Advantage plan offered by the same company. So there is no difference in the coverage. It's the same drug coverage. It's your Part D benefit, either way you get it. And then another quick question, is there any automatic Medicare rollover without actually doing yearly enrollments like private companies do? So I'm assuming you're asking, if you do nothing, will it just keep rolling over from year to year? And the coverage will continue from year to year? And the answer is yes. So if you do nothing during open enrollment and you've decided you simply want to keep that plan for the next year, you do nothing. And it will just automatically assume that that's what you want to do and that you want to keep that plan, and it will continue to keep you enrolled. So you don't have to re-enroll in coverage every year. It does roll over if you do nothing, and they will just love to assume that that's what you intended, is that you will keep the plan that you have into the next year. Again, I do caution you about doing that. with the Medicare Part D coverage, simply because the plans can change, and they can change significantly from one year to another. So as long as you're paying attention to the notices that you're required to be sent every year by your plans that outline any changes that that plan is making from one year to the next, and you're comfortable with those changes, that's fine. But be sure you pay attention to that information so that you know what you're looking at as far as costs and coverage for the next year. But no, the answer is yes, they will just roll over. Another question, Prolia is given in an office, but it is listed on a list of meds at Medicare.gov. Is it covered by D or B? Well, that's a good question. So typically, if you are required to have a medical professional provide an injection to you in a medical setting, it would be covered under Medicare Part B. However, if you go to the pharmacy and pick up that medication and then take it to your doctor's office and give it to them so that they can make up the needle and give you that injection, administer that medication, then the drug would be under Part D. And in the past, that would have never happened. These days, I see it happen more often than not. If it were something that did not have to be given in a medical setting, for example, the shingles shot. The shingles shot has to be administered by a medical professional, but not necessarily in a medical setting. So when you get a shingles shot, you go to the pharmacy, you pay your copay through your Part D plan, but it's a registered nurse or a similar person who actually has to administer that shot to you right then and there at the pharmacy. So that shot is both billed to Medicare Part D and to your Medicare Part B. So it can be both, but if the medication is being provided by the doctor or by the medical professional in the medical setting, it should be Part B, as in boy. Only drugs that you have to pick up at the pharmacy are Part D. So hopefully that answers that question. And it looks like that, oh, here we go. So can I review that? Okay. So again, just to review what we do here at the SHIP office is we help people with these kinds of issues. So we are more than happy to help you by using the Medicare Plan Finder, determine what Part D or Advantage plan might be the most cost-effective or best plan for you. During annual open enrollment, that's all we do. We are inundated with people who come in for that assistance, and we're happy to assist. For people who are just becoming eligible for Medicare, we're happy to assist you as well. If you have gone onto the website and you have questions about the Plan Finder, if you have questions about the results at the end of the Plan Finder, if you want to make sure that you're interpreting that information correctly, we're happy to help with that. We're happy to help in any way that we can with any questions, concerns, or information about any part of your Medicare enrollment or benefits or coverage or the like, your options. So that is really the whole point of what the SHIP program is and what the SHIP program does. That's what we're here for, is to help answer those questions, help make sure that you understand your options clearly so that you can make the most informed decisions. Do you have to use a broker or an agent for any of this? Absolutely not. You do not have to use a broker or an agent for drug coverage, for Advantage plans, for supplements. None of that. You can go directly to the companies yourself and just eliminate that broker or that middleman. You're welcome to come to us and we're happy to help with any of that. And certainly we're not doing it because we're making any money off of any enrollments. We don't do that. We're here to help. We're not here to sell. And so That's one of the reasons that we can't recommend companies one over the other. We can't refer you to insurance agent or broker. What we can do is help you understand your options, answer any questions, and show you, like by using the plan finder, clearly what your most cost-effective options might be. And then here's a comment. Recently, more doctors' offices are doing depression question screenings before you are actually seen by a doctor or a physician's assistant. Are these screenings covered by Medicare or the patient? So I'm assuming the question is that something you're paying extra for, or is that part of your Medicare coverage? And the answer is it should be part of your Medicare coverage. Medicare a couple of years ago changed their regulations, and they strongly encourage providers to screen every patient by asking some questions related to depression or anxiety or mental health in general. And it's something that Medicare pays for as kind of an incentive program to the providers to do that. It's also part of a preventive service type situation. So it's considered a preventive service to you that Medicare wants the doctors and physicians assistants to do with everybody. So it's not something you should pay extra for. And if you are being charged extra or feel you're being charged extra, please call us. Let's have a conversation and see what's going on, because that should not be something that you're charged extra for.
Roma, I have a comment
Sure.
or cautionary tale,
Okay.
especially when people think maybe they don't need Part D because they're not on any drugs.
Mhm.
My husband, who's on Medicare, was diagnosed with pancreatic cancer in November, had surgery to remove his pancreas. So now he's on some very expensive enzymes that he has to take every time he eats for the rest of his life. They're about $2,800 a month. So by February, the second prescription, we were in the donut hole, and now we're paying over $700 a month, 25% of that, and probably until November or so. We are looking at other avenues and help we can get. We're not low income, but you know, something that you don't expect can put you on a very expensive medication. And
Absolutely.
I didn't realize, I guess, that the initial coverage zone, they take the like the market price of the drug. So it only took, you know, 1 month and a half of that prescription at $2,800 a month to get us into the donut hole. And then when you get into the donut hole, they count your 25%
Only,
for
yeah.
reaching that 6,000. So
Yep.
we
And
are
that's,
in it all year.
yeah,
And
and
paying an
that's,
extra $770 a month.
and that is one of the biggest disadvantages to Part D, is how they calculate your costs in that donut hole. One of the handouts that I included in the email I sent earlier kind of goes into that explanation a little bit more. It's a little more detailed than the graph I have up on the screen. But yeah, that is probably the thing I dislike most about Part D, is how they calculate getting you to the other side of that coverage gap. And unfortunately, many times people find themselves stuck in that coverage gap for significantly longer than it took to get them there.
I think they had this drug in mind when they crafted this.
You know, and I can see how it would probably feel that way, quite honestly. And in a situation like that, I mean, the first thing I'm going to want to look at is there any patient assistance programs available? If there's no patient assistance programs for those enzymes, then perhaps there are foundations that are in existence that might be able to provide some financial assistance on those costs. In a situation where you know that this is going to be something he has to do for the rest of his life, typically, you know, there's going to be something out there that will help with that cost, because that cost, you know, whether you're low income or not, that cost can take a bite out of your monthly expenses. and is hard to sustain for a long time. So, you know,
And we're checking with the DA, the drug manufacturer, and then I noted the other things that you had for patient assistance programs. So I will also try.
and certainly if you are hitting dead ends or you need some more, you know, ideas or suggestions, give us a call. We're happy to try and find some other avenues for you to explore.
Thank you. I will.
Absolutely. All right, let's see if there's any other questions. So I have a question. Could a Medigap insurance be used to cover costs in the coverage gap? No. Medigap insurance or Medicare supplement insurance is only going to cover the balance that Medicare left over for Part A and Part B services, period. It does not include drug coverage because original Medicare does not include drug coverage. And as far as I know, there is nothing out there that would help supplement or cover the costs that you incur in the gap of a Part D plan. Other than patient assistance or something like that. So no, that to my knowledge, there is no insurance that you can buy that would actually cover your costs or any part of those costs in the coverage gap of your drug coverage. Next question. So is Medicare Part D, does it have the same rules as Advantage plans that offer drug coverage? Yes. Part D is Part D, whether it's your Advantage plan coverage or a standalone plan. So Advantage plans advertise free drugs, but is there still the large deductible with Medicare Part D? So initially, when Advantage plans exploded onto the market about 5 or 6 years ago, because prior to that, there were only a handful of Advantage plans out there. They weren't very prolific. Advantage plans tend to include Part D at no extra cost, so there's no extra premium to have Part D as part of your Advantage plan, and that's one of the biggest advantages to Advantage plans is that you don't have that extra Part D cost as far as premiums. Do they have deductibles when your drug coverage is part of an Advantage plan? In the past, no. These days, maybe. Some plans do have a Part D deductible at the pharmacy. Some Advantage plans have a Part B deductible as part of their coverage package. It really depends on the plan, and that's one of the things that you want to look at when you're looking at Advantage plans in particular is, again, make sure that the plan covers your drugs and make sure you understand the cost of that drug or those drugs through the plan. Because, you know, even last year I would have said, no, there are no deductibles when your coverage is through an Advantage plan. But these days, yeah, there could be. Now, most plans don't have a deductible, but I'm seeing more and more Advantage plans include Part D deductibles. Again, that's something that the plan finder could help you determine. So when you're using the Medicare Plan Finder to do that search to find what plans cover your drugs for the best price, not only can you do that for standalone drug plans, but you can also do the same search for Advantage plans. And it will give you the same end result, the same information by comparing just the drug coverage of the Advantage plans to make sure that you know what Advantage plans cover your specific medications for the best price. And in addition to that, it will also show you the copay structure for all the other medical benefits with each Advantage plan. So not only would you be able to see the drug coverage costs through the Advantage plans, but you'd also be able to see the medical costs, the copays for medical services for those same Advantage plans. So again, the Plan Finder is going to be an incredibly useful tool when searching to find the coverage that's going to give you the best savings. And go ahead, Pamela.
I just wanted to share with the group, I've spent quite a bit of time with a beneficiary today who went into the plan finder to select a Part D drug plan. And she did that on her own, which was fine. And she selected a plan based on a pharmacy, a particular pharmacy. She lives in a rural community, and she based, in particular, this pharmacy that would deliver to her personally. And come to find out, as she has gone ahead and tried to get prescriptions filled, that in fact, the pharmacy was not a preferred pharmacy or a contracted pharmacy. And so she is having to travel 60 miles now to the nearest pharmacy to get her prescriptions filled. We did a workaround today to see what options she might have, but the takeaway from this is that you need to make sure when you're looking at plans in the plan finder and you're checking with different pharmacies, if you want to get the best deal, you want to look at preferred or in-network pharmacies, of course, along with the idea that all your drugs are covered. Because that was so prevalent today, I wanted to share that with the group. Thank you, Rilma.
Thank you. Yeah, and you know, that's one of the things that can be a little confusing or a little complicated when you're looking at all the plan choices and all your options. There are a million little factors to factor in. There are all those little details that you need to make sure are where you want them to be or need them to be when making a decision. Because, you know, if you pick 5 pharmacies and at the end of your search, the plan that comes up at the top of the list that's going to save you the most money, it may be the plan that saves you the most money, but it may be the plan that saves you the most money at your least preferred of those 5 pharmacies. So you really have to look closely at those results to make sure that you see what costs apply to which pharmacy, because you're going to see, if you pick 5 pharmacies, you're going to see the costs vary from each plan from pharmacy to pharmacy most of the time. So many plans have contracted or made deals with specific pharmacies that if you use that specific pharmacy, you're going to get a much better deal, a much lower cost at the pharmacy by going there versus going to the pharmacy that's right down the street from you. It's all those little things that you need to pay attention to. And that's, you know, one of the advantages of allowing us to help you is that we pay attention to those things. We look at those things, and we've been trained to look at those things. And we've got tons and tons of experience looking at those things for people to make sure that all of those little bits of necessary information are where they need to be for you. Okay, we'll do a couple more questions and then we'll finish up. What happens if you have an allergic reaction to medications that your doctor or pharmacist were unaware, combined ingredients before you took them? Who is responsible for the cost to replace with new medications due to error? That's a tricky one. And that may be something that we'd want to have a one-on-one conversation about. So I will provide my contact information at the end of the presentation. And so please shoot me an email and let's look at that a little more closely. And it looks like that might be all the questions. Again, if there's any other questions anybody might have, feel free to speak up, or again, type into the chat box. All right, well, if there are no more questions, I will go ahead and wrap up the last few slides, and then we'll pause for more questions right before we let you go. Okay, so we talked about the plan finder. Again, in the email that I sent everyone earlier today, I did provide a few handouts. This handout is actually produced by our Division of Insurance up in Denver through the SHIP office, our headquarters up in Denver. And it is a little newspaper, which typically I would hand to you in print form, that they put together every year that lists all the Advantage plans and all the Part D plans available in Colorado only for people to choose from for the next year. Unfortunately, because Medicare rolled out a lot of that information late this year, this newspaper doesn't have as much information as it would normally have, but it does list all of the plan choices. It tells you all of the Advantage plan choices. It can be a very, very helpful document to have, versus the other way you can get that information is by either going onto the plan finder, where it will list all of the choices based on your zip code, or by ordering a Medicare and You handbook specific to Colorado. And so the other publication that you can access to get a list of all of the plans available for Colorado for 2021, both Advantage plans and Part D plans, would be to call 1-800-Medicare and request that they mail you a Medicare and You for 2021 for Colorado. You have to ask specifically for Colorado these days so that it has that list of the plans available in Colorado specifically. They do publish a national handbook that does not list any of that information. And that's unfortunately what they sent us this year to hand out. So it doesn't do much good for many people, but you can ask for the Colorado specific handbook. Now, people who are on Medicare are typically mailed this handbook every year automatically. But if you're just becoming eligible for Medicare, it's not something that has been automatically mailed to you. They usually come in the fall, right before open enrollment, or right during open enrollment. But if you have not been enrolled in Medicare yet, or you're just getting enrolled, if you want 2021, you're going to have to order it by calling 1-800-Medicare, or you can go online to Medicare.gov and download it as a PDF, and it won't have the Colorado specific information, but it will be the national handbook, the version of the handbook. Again, you can go to Medicare.gov to try and find any information or answer any questions that you may have, obviously available all the time. 1-800-Medicare, you can call at any time. They're open 7 days a week, 24 hours a day, 365 days a year, and talk to a live person. I can tell you my best advice to getting through to 1-800-Medicare at any time of the year is to call after hours. Because they're there 24 hours a day, the later in the day that you call them, the easier it is, the quicker it is to get through. And typically they can provide some good information. So to wrap up, obviously we are concerned that there are a number of scams out there. There's always someone looking to get something for nothing, and they're always looking to take advantage of somebody else. And when it comes to Medicare, Medicare benefits, medical situations, or even just being an older adult, you are a target. So our office typically is also the Senior Medicare Patrol, which is the fraud and abuse part of the SHIP program. And that program is designed to educate and empower people to protect, detect, and report potential Medicare and Medicaid fraud, errors, and abuse. The bottom line is, if you have any questions about any part of your coverage, if you have a question about whether or not Medicare should have paid for something, shouldn't have paid for something, what, did the doctor bill something correctly or not correctly? If Medicare denies something, we can help you appeal it. Anytime you have any questions about any part of your Medicare coverage or your Medicare related services, we are here to help, and we're happy to help. This is what we do, and we love to do what we do. So again, any questions, concerns about any part of your Medicare coverage or benefits or billing issues, please give us a call or shoot me an email. And obviously we are a not-for-profit. We are federally funded by grants through the government. And so we are always looking for volunteers. Oh, and I didn't even include the volunteer slide. Well, I suck. Here's the contact information for the SHIP office. Again, my name is Roma. I am the coordinator for the SHIP program. The SHIP program out of our office here in Colorado Springs serves a total of 9 counties in Colorado. We're available through the phone number listed on the screen. You can shoot me an email at the email listed on the screen. Obviously, we're not available for in-person consultation at this time. Hopefully that will change sometime this year. I'm keeping my fingers crossed. Or you can call us through the statewide toll-free number. That number will direct the caller to the closest office, SHIP office, closest to them from where they're calling. So it goes by county. And just so you know, there is a SHIP program available in every county of every state in the country, in the United States and their territories. Because this is a federally funded program, it is designed to help all Medicare beneficiaries everywhere. So there's always a SHIP office available to anybody, no matter where they're at. And we, again, are happy to help. So please let us know if we can. And just lastly, but not leastly, also want to mention that we appreciate your attending this 4-part series for Medicare 101. This is in partnership with our Pikes Peak Library District, who has been a very gracious and very productive partner for our Medicare series. We love partnering with them. And hopefully one of these days we'll get back to actually doing these presentations at the libraries. But we really do value and appreciate that partnership with the Pikes Peak Library District. I know many people found out about this series through the library district, so we do appreciate that. And with that being said, that is all I have for you tonight. Again, any last minute questions, please let me know. Speak up or type me a chat. Otherwise, again, I'm happy to answer any questions. You're welcome to email me or give us a call at any time down the road, and we're happy to talk to you, or I'm happy to get an email from you to address any other questions. Part 4 of this 4-part series, again, next Thursday evening, and we will talk about other options, other Medicare related insurance options, such as Medicaid, employer coverage, retiree coverage, COBRA coverage. So we're going to cover a whole myriad of different kinds of benefits that you might have access to. So hopefully that'll be helpful, and hopefully I will see you all there. And I think that's all I've got for tonight. We appreciate your attendance. We appreciate you coming tonight. And hopefully I'll see you next week, and everybody stay safe and warm.